Angel, and welcome to my podcast, Gen Z Era. Tonight, we'll be talking about the application of motivational interviewing in counseling the TikTok addiction of adolescents. In the contemporary world, there is no denying that teenagers are consumed by social media, especially TikTok. A study says that the great degree of boredom an average adolescent attains nowadays has a significant effect on the addiction to short video applications. As an avid user of TikTok, I cannot deny this fact. If I have free time, I'll go on TikTok. If I'm bored, TikTok. If anyone wants to be relevant and in trend these days, TikTok is the answer. Like, are you even part of Gen Z if you're not on TikTok? Specifically speaking, trait boredom is increasing among adolescents. It is defined as the general lack of interest in the static environment, leading to a disconnection from reality. Scholars found out that trait boredom peaked during the COVID-19 outbreak, which makes sense because everyone was at home during the lockdown. This type of boredom is actually, quote unquote, a long term and chronic emotional tendency which is related to various mental health conditions. As I continue to talk about TikTok addiction, I am referring to a behavioral addiction. Behavioral addiction is listed in the Diagnostic Manuals of Mental Disorders, otherwise known as the DSM. This is different from a substance abuse disorder, as a drug addiction alters the pleasure circuit in the brain, causing one to want more drugs to get that release of dopamine, and includes physical signs. In contrast, behavioral addiction is a compulsion to do a certain action repeatedly and doesn't include physical signs. Now, motivational interviewing is a counseling approach created by William Miller which explores and resolves a patient's ambivalence by eliciting one's internal motivations for change. Motivational interviewing is effective in reducing the level of TikTok addiction among adolescents. As a result of a TikTok addiction, there is great influx of short attention span, loss of learning, and poor time management among teenagers. However, if one simply tells them to stop, they will not stop. Adolescence is the period of the greatest biological, psychological, and social role changes. It is also a period of seeking conformity and identity. This difficult period of evolution causes a typical teenager to be grumpy when instructed on what to do with no explanations. Studies say that learning to change harmful behaviors during adolescence is crucial to becoming a competent adult. This is why I believe motivational interviewing is effective in counseling teenagers about their TikTok usage. This is relevant in my current and future nursing practice because technology is dominating the whole world. If not properly counseled, intelligence and productivity will continue to deplete among adolescents. Motivational interviewing provides the human touch of compassion, acceptance, and empathy that robots cannot provide. In terms of applying a plan of care, the communication skills of motivational interviewing, which are open-ended questions, affirmations, reflection, and summary, allow teenagers to think and explore, which helps in the development of their cognitive control. More importantly, no matter what an adolescent's perspective is, it will be validated through motivational interviewing because its core includes accepting a patient's point of view. A healthcare provider with an advanced education and medical jargon may feel frustrated at a teenager for ignoring his advice because he knows better, right? Now, this urge to be an expert actually builds more resistance to eliciting change as teenagers will become rebellious, reluctant, create a rationale, or resign from the idea of reducing TikTok usage. Instead, roll with resistance. Ambivalence is a part of eliciting change. As a teenager, I don't like it when adults sugarcoat the message they're trying to say. Most teenagers desire to be talked to as adults. Be straightforward, direct, and honest, yet empathetic. If a teenager becomes rebellious, tell them they are right and validate their capability of making a decision. If they are reluctant, Ask permission to provide information about the consequences of a TikTok addiction. Ask evocative questions to explore their life without TikTok in the past and the future. Any person will not elicit a change in their behavior if they are not ready. Motivational interviewing includes examining the level of importance of that particular change and the patient's level of confidence in executing that change. Utilizing the readiness ruler will allow a teenager to further think about themselves and explore their ambivalence. A study conducted at Sinop University provided 10 sessions of motivational interviewing for internet use addiction among its students who participated. The experiment involved 18 and 19-year-old students. The sessions can be described as taking one step at a time because the adolescents were only getting to know each other in the first session. Eventually, by the seventh session, strategies were shared on how to reduce usage of the internet. Through pre- and post-attitude tests, the study found that there was a decrease in internet addiction among the students who participated in motivational interviewing when compared to those who did not participate. Learning about the application of motivational interviewing to counseling adolescents with a TikTok addiction reduces my fear of communicating with them. Infallibility among teenagers intimidated me. I didn't know how to approach or talk to them from a healthcare provider's perspective before learning about motivational interviewing. As a teenager myself, I've never experienced exploring my ambivalence because I always encountered an quote unquote expert in healthcare who always told me what to do. This learning impacted my assumptions about communicating and providing care to adolescents because of the normalization of technology. Prior to learning about motivational interviewing, I thought healthcare providers only provided advice when counseling. Developing impactful communication skills is difficult yet critical in providing competent care. Vulnerable adolescents will remember how a healthcare provider will communicate with them. If they have a negative experience, young adults will tend to avoid seeking help in the future. Based on my learning, I believe I have the tools through challenging interactions with teenagers. From building rapport to supporting adolescents with their plans of change, the key is effective listening. When conversing with young adults, expressions of empathy and effective listening are critical because feelings of being misunderstood and not being accepted are common. I chose this topic because I don't want to ever forget about this communication style to elicit change. As I get older and develop skills, I hope to be consistent in utilizing motivational interviewing with communicating with patients, especially teenagers, because I empathize with the feeling of not being heard properly. Thanks for listening to my podcast, everyone. I hope that one learned about utilizing motivational interviewing when counseling teenagers about their TikTok addiction.